Hi, everybody. My name is Joan Widmer. I'm the interim executive director of the New Hampshire Healthy Climate Organization, as well as the treasurer on the board of directors. And I want to welcome all of you for joining our webinar this evening. And thank you for participating. I've heard Dr. Alahmad present some of this information in the past, and I asked him to come speak to our organization because I thought it was incredibly impactful information, particularly in the state of New Hampshire, which is always looking at, the financial benefits of anything that they do. And I think this demonstrates that being conscientious about heat in a warming environment, if you're an outdoor worker, actually improves worker productivity, but I don't want to steal Dr. Ahmed's thunder. So I'd like to also remind everybody to keep their audio off while the presentation is ongoing so that we don't have any feedback. And we'll have a Q&A at the end of the presentation. And if you have in the meantime, you think of a question, I'm afraid you're going to not remember it, just put it in the chat. And Emily Johnson, our Director of Operations, will review those questions during the Q&A session. I'd like to also, as you probably all heard, we're recording this webinar. We post them to our YouTube channel so that people who aren't able to come on the evening of the performance can watch them at a later date. And we've also recently discovered that we're getting a lot of views. We've had webinars with as many as 3,000 hits. So that's phenomenal that we're getting our messaging out there. I want to do a recitation of our land acknowledgement as we begin. This webinar takes place in the Dakina, which translates to our homeland and is currently called New Hampshire and Vermont. Dakina is the unceded traditional ancestral homelands and waterways of the Pennacook, Abenaki, and Wabanaki peoples, past and present. We acknowledge and honor with gratitude the land, water, air, flora, and fauna, and the beings who have stewarded Nadakana throughout the generations over the past 12,000 years. Next, I would like to introduce our speaker this evening, Dr. Barrak Alahmad. As we posted on our website, Dr. Alahmad is a instructor at the Department of Environmental Health at Harvard T.H. Chan School of Public Health. He holds a medical degree from the University of Liverpool, United in the UK, a master's in public health from Johns Hopkins Bloomberg School of Public Health, and a doctorate in population health sciences from the Harvard T.H. Chan School of Public Health. He studies climate change and health in the Middle East, specifically the adverse impacts of dust storms and extreme temperatures on vulnerable populations. He has extensively studied the effects of environmental exposure on migrant workers in Kuwait. His work has been highlighted by professional health organizations, including the World Health Organization and the American Heart Association, and numerous media outlets, including BBC, CNN, New York Times, The Guardian, and others. In 2022, he was named to the inaugural 40 Under 40 Public Health Catalyst list by the Boston Congress of Public Health, recognizing rising leaders and innovators in the field. In 2023, he received the Rebecca James Baker Award from the International Society of Environmental Epidemiology for his collaborative and international research in environmental cardiology and health equity for migrant workers. And this year, the American Association for the Advancement of Science Board Council honored him with the AAAS Early Career Award for Public Engagement with Science, recognizing his outstanding contributions to engaging the general public and the migrant workforce on heat and health in Kuwait. So thank you very much, Dr. Ahmed, for coming tonight, and we're looking forward to hearing your presentation.
John, thank you so much. And I think this is a note for myself. Next time I'm going to send a bio, I'm going to make it much shorter. Thank you for reading all of this. This is really nice. And I'm very happy to join you this evening. Let me get my slides going and we'll just get cracking. I'm going to talk about the future of outdoor labor in this warming climate. So, what does this mean for us? I'm going to go over what I do, as John covered all of it and more. But I'll tell you my name. My name is Barack, and I do share a name with Obama, but I don't think that my degrees, the 3 degrees that I have, would make up the difference, at least in height, between me and Obama, or maybe the handsomeness, actually. So yeah, but my name was got very popular after 2008. But I'm from Kuwait City, Kuwait, and this picture probably just shows you what the kind of exposures that we deal with in Kuwait. Birds here try to find shade from the sun. When I was a child, I used to think that they're trying to hide behind the tree, and the birds are so stupid, so I can just run at them and disrupt the whole all the birds. But actually, this is one way of trying to stay healthy. And if this is what the birds do, what about humans? So that's probably got me going and thinking about the effects of climate change and extreme heat on health. I'm going to talk about 5 things today. First, I'm going to show you that heat is a global public health problem. And then I'm going to show you some evidence that we're collecting on the effects of heat on the heart, on the kidney, and the brain. I'm going to summarize to my best ability the available science that is out there. Most of it is new and recent, and this is what I've been seeing in the past few years. And mostly I'll focus on the future of outdoor work. What does this look like now? And I'll show you that there are some regions and groups that we really don't have data about, and that becomes a problem. But I'm going to end with a positive note. So whenever you see everything is dark and gloomy, come the end of the talk, I'll show you effective practical solutions and data that we collected about this. I like this graph. It comes from the IPCC 2021, this Bible of climate change, if you like. And they show this in a very nice way. And they show you that for baby boomers, those are born in the 1950s, in 2020, they're about 70 years old. So when you talk to baby boomers about, 2060 or 2000, that seems another generation. This is another life. It's probably not their life. But for millennials, this I would put myself in this category. We're 70 years old in 2050. So if I see projections by 2050, I personally get concerned because this will be well within my lifetime. But if you look at COVID babies, and I know a lot of COVID babies, they're born in 2020. By 2090, they're 70 years old. So all the projections that we see by the end of the century, it's not distant. It's in fact their lifetime. This is what they're going to witness. I find this to be very powerful graphic that shows generations may be selfish in thinking about what affects them and what affects future generations. But in climate change and the effects on temperatures take a difference and increase in the mean and in the variance. So if you think of the 1.5 degrees Celsius change in Paris Agreement, this is probably just a shift in the mean. This is what we see here. That's just shifting it all to the right. But actually, what we're also seeing is an increase in the variance, which means pushing the curve down and having more frequencies of those tails. So this is what we end up seeing is that there would be much more record hot days, and these are happening more often. And think about countries and regions and areas where they're already hot. So this is pushing them into new areas that are not experienced and precedented before. Like Kuwait, this is where I'm from. One study looked at an observation of 54 degrees Celsius. That was the highest officially recognized temperature that ever been recorded in 76 years. This is a lot of the temperatures. This keeps breaking all the records. There's a TikTok video actually of someone cooking an egg on the asphalt, and he actually cooks. So this is the kind of temperatures that we're seeing, and I try to understand how does this affect the overall changes in these temperatures when it comes to already hot country. So instead of looking at references that looks at pre-industrial times, we're looking at the first decade of this of 2000 to 2009 of this millennia. And then we probably could see for places like Kuwait about 5 degrees Celsius, maybe 2.5 degrees Celsius, depending on how we look at the scenarios, whether we look at extreme scenarios or not. So let me just dive deep into the epidemiology of heat. So why do we get concerned about this? Well, if you go on the CDC website, first thing that you will see is heat stroke. That's the first probably brochure that you look at. Let me tell you, heat stroke is very rare. It doesn't happen that often, and it is also preventable. And when it comes to death certificates, which most of us have filled these death certificates or looked at them, when it comes to the underlying primary cause of death, while there is a heat stroke code for it, which is the ICD-10 code, the T67, the death certificates, when you collect all the data, they don't show a lot of heat stroke deaths. Well, that has many reasons. Number one, maybe there's a chronic underestimation or recognition by clinicians, which is definitely an issue. Or it could be that heat stroke are actually rare. But missing from this is that heat might not be the primary cause of death leading to the train of events that led to the death, but it could be a contributing cause. Meaning, if someone has a heart disease, and they get exposed to heat, that could lead to a plaque rupture, that could lead to ischemic heart disease or a worsening of heart failure. And then the cause of death becomes heart failure or ischemic heart disease. So heat doesn't make it into death certificates. And so if you only look at death certificates, I'm telling you, you're not going to find much. But that's not the case because we know from the pathophysiology that actually heat affects the heart. It affects the heart in different ways. There's one review that was done at Nature Cardiology Reviews. We looked at all the possible ways in which this can lead to ischemia or stroke. And I had this exercise of collecting data from 27 countries. So we emailed, it was COVID and I was bored and I had to do something for my PhD. So I just probably just bombarded people with emails and collecting data from different countries. We reached 567 cities and 32 million data points that we had at different causes of heart disease. And these are causes of death. This was about the largest database ever assembled on environmental exposure. So we linked heart-related causes of death with temperatures, and we did an epidemiological study. And what we found is not surprising. The increase in temperatures, if you look at temperature percentiles, they're in percentiles here because we're pooling across different number of countries. It shows sharp increase in the relative risk of death for extreme heat and also for cold. And this holds for not only all-cause cardiovascular disease, but also for things like ischemic heart disease, is for heart failures, for stroke. So we started to see more of this. And then we estimated across a number of countries how much excess deaths are attributed to heat. And we found, for example, with ischemic heart disease, for every 1,000 deaths, there's 2.3 excess deaths that are attributed to hot days. Now, you might think this is 2 cases for every 1,000. That doesn't seem to be a lot. But hold your thought. First, cardiovascular disease is the leading cause of death globally. So if you apply these proportions globally, that translates into a very large number. And then secondly, we're going to talk about how frequent these events happen. And in the past history, these events, hot events, did not happen that much. When we look at cold deaths, we found cold deaths to be really high, probably to a magnitude of 9 to 1 compared to heat deaths. And we'll get to talk about why are we more concerned about heat or are we more concerned about cold? So I put this, it was large paper consortium of people just putting this and showing associations between extreme temperatures and cardiovascular disease. And I could get the American Heart Association to finally have something out and saying, actually, extreme temperatures now, hot and cold could be a driving risk factor. Since we've been focusing much on diabetes and smoking and tobacco and alcohol and all of these things, but in fact, temperature and the environment could have a major effect on this. I was on TV. This is my few minutes of fame. I don't know why they decided to put my face on this big. The ratio does not make any sense. And then one day, and I was just sitting at home, and then my phone just exploded with notifications. It was going like ping, 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 ping. I don't know what's going on. And it appears to be that my study was quoted. It was quoted by Donald Trump Jr., who said, seems legit, dot, 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 if you're an idiot. And then this says that increased heart failure deaths are linked to extreme hot and cold deaths, which is probably looking at why cold deaths are higher than hot deaths. So, in response to Donald Trump Jr., I wrote to the Lancet Planetary Health, which I'm sure that Donald Trump Jr. reads every day. And in the Lancet Planetary Health, we asked the question, are there more cold deaths than heat deaths? So let's look at the data. This is Barcelona in Spain from 2000 until 2018. This is the dose response relationship, temperature and relative risk at 23.6 Celsius. That's probably the minimum mortality temperature. Anything above that, the risks take off. You will see here that the extreme hot temperature has a relative risk of 2.5. It's like double, more than cold, but yet cold deaths per year are 567 and heat deaths are only 29 despite having this dose response. So why is this? And if you look at the graph that shows how many days actually we have seen with this temperature, and turned out this extreme hot day that led to about 200% increase happened only once in Barcelona. And the cold days with much less risk happen more often. Now, the question is, this is why we get very concerned with climate change is, what if this bubble starts to get bigger? And that's what we know. We know from the climate science that there would be more extreme heat days that are happening with higher magnitude, which means higher range in here, and more frequency and duration. So that's why we're probably concerned and concerned a lot about the effects of heat, as, along with cold as well. But let's move from the heart to the brain. This is a very nice study that I usually show and talk about with students that we have. This is college students. And college students, when they come, they're randomly assigned to buildings where they will be living. So these accommodation buildings, some of them have AC, some of them don't have AC. They're very old buildings, and they're just a random allocation, which, by the way, gives a very nice quasi-experimental setting that we can use to test. So we gave the students a test on their phones that they will do a Stroop color test. It's very confusing. It's red, but it says green, and it will measure how much time you take to answer this question. Give you addition and subtraction, like two numbers, 66 plus 15 will measure how much time you take to answer these. And look at the results. This separation between these kids, students and college students that were living in AC, actually tend to do better than students that did not live in these AC buildings. And the study quoted that they saw a significant decrement in the cognitive test performance. But these are college kids. The stakes are not that high. I mean, chances are they would get their grades and graduate. But let's look at work. Now, the stakes are really high for a construction worker trying to do hand-eye coordination and doing things under extreme hot thermal discomfort. What does this mean for them? And the ILO put together a table of things that they think these are related to extreme hot weather. Mental fatigue is important because you tend to make more errors at work. And there is increase in accidents. There is actually more evidence coming out on your decision-making ability or ability to make judgments or your irritability in general when you're exposed to extreme hot temperatures. So the question was, do occupational heat increase accidents and injuries? And this is a meta-analysis of 24 studies from 6 different countries. They found 17% increase in the risk of injury during a heat wave versus not a heat wave. So that shows you whatever effect that the heat is having, subtle enough to make you have a cognitive impairment slightly than your best, than your physical best and mental best, that could translate into a mishap, to a mistake, to an error, into an injury, an accident. And this could become more tragic. But other than the brain and the heart, there is emerging evidence on the effect on the kidneys. And the kidneys are in real trouble because of low-grade muscle injury for workers. Because they work so hard, they break down the muscle. And also there is a volume loss and with salt, and there is water loss as well. So there's dehydration and salt loss that along with these three, they form this repetitive insults to the kidneys. And in Mesoamerica and Central America, you see in areas like Guatemala, Honduras, Nicaragua, Costa Rica, and in Mexico, there are clusters of chronic kidney failure among communities that are in the sugarcane uh, farms. And you don't need a fancy epidemiology degree to just put the clusters that you see and where the sugarcane communities are. And you just see this massive increase in chronic kidney failure. And this has been documented in many places. And I like this by Aaron Baker on Time Magazine. It's funny that I was talking to Aaron earlier this morning. Uh, She put it as a chronic kidney disease is poised to become the black lung of climate change. And the Washington Post had this picture of this Nepali worker who they captured as the world's torrid future is actually etched in the crippled kidneys of Nepali workers. And this person is only 37 years old and is on a dialysis machine. So when we look at heat and workers, in 2018, the ILO, the International Labour Organization, said, we think there is a 1 billion worker that is exposed to extreme heat. That was 2018. 2024, but 6 years later, they said, hang on a minute, we're increasing our estimate. We don't think it's the 1 billion anymore. We think it's about 2.4 billion workers being exposed annually to extreme heat at work. And I thought these numbers are, probably blown up out of proportion. But if you look at what scientists say, they said, actually, we think these numbers are probably conservative. They think depending on future socioeconomic development, these numbers could rather increase. I mean, right now we're probably at 9 billion total population of Earth. Maybe they're thinking there is an increase and that would increase these numbers. Whatever the real estimate, we don't know. We just know that this is probably a big problem and it's quoted with really massive numbers by international organizations. But one thing that I touched upon was the mental impairment that you have in extreme heat. But the studies also show, like this study, for example, that built a model that your physical work capacity is also reduced with extreme temperatures. So, for example, your physical best can be seen at maybe 15 or 20 degree Celsius in the wet bulb globe temperature. which is a measure, a composite measure of many other environmental factors, including humidity and solar radiation. This could drop to 90% at around 25, maybe 70%. You could be operating at only 20% of your physical work capacity. But these models are they're just it's just a curve. How do they actually measure these things? So usually what they do is they get number of college students that are volunteers. It's mostly male studies as well in most of the literature that I've seen. And they put them in human chambers. And in these human chambers, they put cold chamber and a hot chamber. And in the hot chamber, for example, they increase the temperature and the relative humidity. They put the participant on a treadmill, right? Increase the speed, increase the incline in order to get their heart rate to be at 130. So that's the fixed heart rate protocol. So I'm getting you to work to the point where your heart rate is 130. And I do this with speed and incline. Do it in a hot chamber, and then I'll do it in a cold chamber, where also I get you to 130. Because I looked at the speed and incline, I can calculate your total energy generated or expenditure in each of these chambers. And then I look at the curve. The curve shows me what is your best performance, how much energy you expended, having the same heart rate. So we maintain the same heart rate, and then you'll see that immediately there is a difference between the cold chamber and the hot chamber. They do it over a number of participants, and they come up with models that look like this, that shows productivity losses. Now, these models then is what you see in many articles that are quoted that shows about 1 trillion hours would be lost in work time in just 2023 due to heat exposure. In the US, this would be about 3.4 billion working hours that are lost of because of this loss of physical work capacity that it's just being reduced because of the extreme temperatures. And that is an equivalent of 20 hours lost per every employed person in the US. So these numbers could translate into real massive economic hits on the country if we just decide to do absolutely nothing. But other than who is doing this kind of work, and one area of interest that I have been involved with in Kuwait is migration. So we have a lot of migrant workers that come and work in Kuwait, and they are the ones who are doing all the work. And in the US here, you also see a lot of documented and undocumented immigrants working in farms and working in construction sites. But workers are also migrating because of climate in many cases. In fact, if you look at causes of displacement of people leaving their homes, you will see there's more than double of conflict. Environmental disasters lead to more displacement than what it is for conflict. But unlike conflicts, refugees who have an internationally recognized legal definition for someone who is fleeing conflict, this is not the same for climate migrants. There is no international definition for someone who's leaving their home because it was destroyed by climate change and extreme weather events. Take Nepal, for example. I work with a large number of NGOs and indeed with the government in Nepal. And in just, for example, in this example, flash floods just in 2021, unseasonable. It's in a time that farmers did not expect. It just flooded everything, destroyed homes, communities, farms, everything. But what happens is that recruiters would then go to these climate hit places and use climate change actually to recruit workers from affected areas and bring them to another part of the world where they are actually abandoned. So this form of trafficking of workers actually happen. And we've seen many examples of this. This is, for example, here in Qatar, and there are many reports in Amnesty International and other reports that looked at this. But let me show you data that I examined personally in Kuwait. So migrant workers, you would expect them to be middle-aged, healthy in general, but you'll see that there is somewhat of a neighborhoods that are clustered probably by design from the government, where migrant workers are put in certain areas and the Kuwaitis are put in another area. So that definitely put stress on countries, on systems, on healthcare systems. What happens when you're exposed to extreme temperatures, and happens if an entire neighborhood does not have any resilience to extreme temperatures? So we looked at cumulative stressors. What does this mean? Well, we look at the environment and the community and the workplace and the individual level factors. And we find that migrant workers in particular are very much affected, with layers of their health being shaved with these different factors affecting them and affecting their health. And I call this the double whammy on migrant workers, because they're hit with climate change, with extreme weather events in their home country. And once they migrate and they go to another country like Qatar or Kuwait or Saudi Arabia, they're hit again with unprecedented heat triggered by climate change. So it's a tragic event, a sequence of events in which workers and migrant workers are at the forefront and the front line of climate change. But the problem is that we in most of the data that we examine, many parts of the world that are affected more by extreme hot weather and extreme conditions, we don't have data from. So if there's no data, no problem, or actually, in fact, that's more of a problem. In Kuwait, we looked at accidents and injuries, for example, and we start to see massive increase in the risks. That could be about 40%, 50% increase. That's more than the 17% that a meta-analysis showed. So in areas where extreme temperatures are reaching with vulnerable communities, mostly there are no global data that we can use to analyze. So these are the areas where we see the majority of the effects. And we started also to see effects on kidney health. We talked about the double or triple effects on kidneys, and you'll see complete different curves when temperatures are increasing and you see admissions, for example, for acute kidney failure in Kuwait between the Kuwaitis and the non-Kuwaitis. But now let's move into what is the available evidence that we have on supporting effective solutions for work and extreme heat. The problems, discuss them. It's the kidneys, it's the heart, it's your brain function and cognitive function, and you making errors and mistakes in physical work capacity and productivity losses. All of these are problems. But let me introduce you to the La Isla Network, which I've been working with for the past couple of years. And La Isla Network is a research and advisory NGO, and they've done data-driven research across a number of countries in Central America. And my friend Jason Glazer, the CEO of La Isla Network, was actually selected in 2024 as Time 100 because of all the work that La Isla Network did in farms in Central America. So let me tell you what happened. 2017, La Isla Network signed a memorandum of understanding with the Ingenio San Antonio Sugar Mill and the National Committee for the Sugarcane Producers and Bonsucro, the alcohol company, to actually have interventions at the workplace. And here are the interventions. Very simple, no rocket science in here. Scheduled breaks, shade, water, and available bathrooms and sanitation facilities for workers. Many workers, they don't want to drink water because the bathrooms are really far from where they are, so they would rather be dehydrated than taking a longer time to get there. have sanitation, good hygiene, water, shade, and scheduled breaks. Nothing really fancy in here. But here's what they did. They measured everything. They strapped the workers with monitors for their heart rate, skin temperature, made them swallow these pills, these fancy pills that tells you exactly your core body temperature at every minute. They took samples of the urine, looked at the actual temperature outside. There were cameras recording your movement, the worker's movement to measure the metabolic rate. All of this is just like a galore of data, a lot of data points that were collected, physiological data. And the results were just fascinating. Let me show you this. So we know the core body temperature has to stay at 38 degrees Celsius. I'm sorry that I speak Celsius, I don't speak Fahrenheit, but I'm sure many of you would know I think it's 103.4 Fahrenheit. This is your core body temperature, beyond which the WHO and many physiological studies say this puts you in a danger zone. So let's look at this. This is the first site here. No improvements, just business as usual. And what you see is this drop in the core body temperature because there's one rest, and that was the lunch break. So you get only the lunch break. This is what happens. Once you're back, core body temperature keeps rising. But this is the intervention that La Isla Network did. They did one, two, three, four, five, 6 breaks. 6 breaks. The result is this is all kept under 38 degrees Celsius. And I know what you're saying. You're giving 6 breaks to workers? I mean, what's the whole point? The whole point for an employer is actually to get the workers to get the work done, right? Hold your thought. Gonna get to it. But let's look at the acute kidney injury hospitalization. These are the cutters, the burned cane cutters and the seed cutters, the very high workload. You got a machete and you're cutting all these sugarcane. In Harvest 1 in 2017-18, the AKI, acute kidney injury hospitalization, was about 9.4%. And with interventions, we started to see less and less and less. In fact, among these medium and low workload, the field support, the drip irrigation repair people, we almost get to an elimination of the acute kidney injury. This is because of the rest breaks, the shades, the water, and sanitation. Simple as that. And then if you compare this, if you give two arbitrary breaks, and this is the old one that just shows one break at the lunch break or whatever, and it's more driven by the data, actually. That's what the initiative that Laisa Network did, that giving these multiple breaks actually kept the time where the 38 degrees Celsius was exceeded only at 9%. But the incident kidney injury, which is slightly an epidemiological measure for acute kidney injury, was dropped from a 30% to just about 1%. That's a very effective solution in looking at the health effects. But I know all of you are thinking, oh my God, 6 breaks. What does this mean for the productivity of workers? And I showed this graph, and this is probably the graph that Joan actually invited me to talk to you today, is to present this graph. To borrow a phrase, the big, beautiful graph, this would fit into a big, beautiful graph. Maybe I shouldn't have used this phrase. So let's look at these are all the years in which the data was collected in these sugar farms from 2012 until 2022. And one thing that you need to know about these sugar farms is that how are they paid? They're paid by the bunch. So come the end of the day, how much you collected, you put it on a scale, and then they give you exactly how much you earned that day. While this is terrible working conditions, it gives us the perfect, most objective measure of productivity because I know exactly how much you collected every single day. So let's look at the yellow lines here where this is the hours worked. This is before the interventions. So the workers used to work 8 hours a day, no breaks. This dropped into 6 hours when the intervention started, 5 hours, and now they're only working about 4.7 hours. That's almost half of the hours worked. But look at the tons per hour. This doubled from zero point 0.8 tons per hour to about 1.57 tons per hour. And the overall production you see in these bars from the sugar mills did not change. In fact, it actually slightly increased. That's the overall of how much they gathered in sugarcane. So that shows that graph actually, at first you will think too many breaks, not intuitive. But if you've done any HIIT training or you've been to the gym or just doing a fast sprint and then you take a break, you rest, guess what? When you come back stronger and you come back more focused. And this actually showed an increase in productivity, almost a double of the productivity per worker for the tons produced. And I'm no economist, but I have a friend who did some measurements and numbers, and they found actually for every $1 that was spent by the sugar mills, there was 60% return on investment. So that's $1.60 in return. And this is because of lower staff turnover, reduced absenteeism, reduced accidents, reduced hospital care. All these things are now bringing in money for the sugar mills. So overall, there was across all the groups, there was about 23% less work. But guess what? There was a 90% reduction in kidney injury. There was an increase in productivity, and there was 60% return on investment. And for the industry, it's also a win-win. The industry gets to have an increased productivity. They mitigate their liability. They strengthen their market position being a responsible company, and they reduce harm for their workforce. And there are many examples of diseases in which in occupational health that we try to eliminate, and probably we're momentarily successful in doing that. It is very sad that we see parts of the news now that black lung disease is reappearing in the United States when we know exactly how to eliminate black lung disease. We know how to eliminate silicosis, one of the oldest occupational diseases that ever exist. But we have a chance now also to think about heat and trying to find an intervention that actually would get us somewhere close to elimination. That's how we think about it in public health. Our brains should switch from treating an ill patient that just showed up in front of your door to actually having to think about preventing this from the beginning. So the Adelante initiative from the La Isla Network gained recognition everywhere from the International Labor Organization, International Institution. In 2024, they were doing peer-to-peer learning, improving, changing, adding more things. But unfortunately, all the funding that was going to La Isla Network was abruptly stopped in 2025. So that also affected the future cohort that we were trying to recruit and think about different ways of having wearable devices and improvement to what we already know as also all halted. And these are my take-home messages. I'm going to end here. We talked about heat being as a global public health problem. It affects your heart, it affects your kidney, it affects your brain and your cognitive function. And the available science sends clear warning about the future of outdoor work, the future of outdoor work as we know it. And there are regions and groups like migrant workers that are most affected with the least available data. And that makes it a huge problem. But the bright spot is that we found very good evidence in support of effective solutions that are also a win-win for the industry and for the workers. I have to thank many people that contributed to many of these studies and funding that we got from different parts of uh, the world in Abu Dhabi, in Cyprus, Nepal, Kuwait, the MCC network, many other collaborators. And I want to say, don't give up on outreach. I think this is really important. This is why I think John and I share this urge to communicate the science in the best way that we can. I was invited to testify before the UK Parliament. I was super excited. I thought I'm gonna go there in London, wear all these wigs and show up there. And the next email comes and said, "Oh, it's gonna be on Zoom." Oh my God, why do you have to do that? I thought I'm gonna be, have lived the experience. But I also had the chance to talk to the BBC, CNN. Whenever I have the chance, actually, I just go for it and use the privilege that we have and all the science that we generate in actually communicating this and getting the message out. I'd like to thank you, and this is my email. And one of my friends in Christmas sent me this portrait that put the Donald Trump Jr. quote on my study. And there's like, "Merry Christmas, ha ha ha." Well, I guess I'll take that. Thank you.
Barrak, thank you so much for this marvelous presentation. I really enjoyed it, and I'm gonna get the questioning started off because my first thought in all this information you shared, has anybody shared any data about the acute kidney injury and the way to mitigate it and prevent it with workers' comp insurers? Because to me, this is a group of people that would have a vested interest, might even help fund some of the work that you're doing and share that information broadly with their client base because it's going to help reduce their costs.
This is really important, and I wish we could get more recognition on the chronic kidney failure. That is the outcome after a repetitive acute kidney injury. The field has evolved. And so 10 years ago, maybe 15 years ago, you would find a lot of skepticism. There were actually some pushback saying, well, it's the pesticides in Central America. Oh,
Mm.
it's the water in Central America. Sure. What about the Middle East? I can tell you, Kuwait, there are no pesticides in construction sites, okay? And then with more and more accumulating evidence, I think it's becoming clearer that the case is there, but there will always be doubt, and there will always be manufactured doubt about, is it really an effect? Is it not this other infectious disease, tick-borne disease that causes chronic kidney failure? So we're getting there, and I think I started to see many more publications and scientific evidence in the US showing the burden. Remember, just if you go to up to date, which many clinicians use, they still call this the Mesoamerican nephropathy. And it has different terms. It evolved, and then now it's called the chronic kidney disease NT, non-traditional. They used to call it CKD-U, unknown CKD, and then it became CKD non-traditional, and people still calling it Mesoamerican nephropathy. I mean, we've seen this in many different forms, but I think we're getting there.
Any other
Yeah,
questions?
I can certainly see that the workman's comp people would deny that it's related to the work, that it's something else causing the kidney failure, and then they're not really on the hook for the long-term medical expense of kidney failure of these workers, because in the U.S., Medicare picks up, I believe, 100% of the chronic kidney dialysis cost. So they're not going to be out the big bucks for the real true cost of this disease.
Yeah.
Any other questions? We have another 9 minutes.
I have a question. Thank you for your advocacy and for working on this. Truly appreciate it, and for this space as well. Um, I My name is Juan, and I work at the Washington State Department of Health here in Washington State. And we work directly with farm worker housing and agricultural workers. And I'm a section manager overseeing our health and safety inspections of these facilities. We conduct inspections pre-occupancy, prior to the workers arriving and during the harvest season. And my first-hand experience in the last couple of years, and I actually have some of my team in this call as well, which I'm very proud of.
Right.
Myra and Jerry are here, and we have been on Myra, for example, has done these inspections for about 20 years, and she's one of our best. But going on inspections when we first started this program, about we Jerry and I joined this program. This program's been around for 2 decades, but we joined and we went on inspections of cherry harvest tent camps and other facilities around the state. And during that time and during those visits, I learned quickly the effects of climate change and how the extreme heat, wildfire smoke, and all that was affecting the workers. And the reason I give you all this kind of background is I started connecting with our leadership, connecting with labor advocates and other committees, and trying to find out what's being done. Like, why isn't anything being done to improve the infrastructure, to do more research, and seeing the type of work that you have done, Barrak, and now just seeing at the global scale, I was frustrated in just learning, internally trying to do research here and do work that there was nothing out there. There was not a lot of data, like, and I guess that what I'm trying to say is, like, why is that in your experience? Because I've done it at the state level, and one thing I wanted to add is that after I finished my master, I did a public health management certificate at the University of Washington, and I did that for a year. My project was focused on temporary worker housing and the effects of climate change. I'm getting a second master pretty soon, and I'm going to start at the University of Washington in infrastructure planning and management, and I'm hoping to kind of bring that as well to the conversation. I'm part of a few committees too, but what I'm run into is this kind of gridlock of information. Like, we need data to show what's happening.
I mean,
And it's
I
like,
cannot agree more
wow,
with you. I am not from the US, and I am shocked by how little we know about work
mhm,
sites and how hot they get. I'm
yeah,
absolutely shocked. And the fact that La Isla Network had to go to Central America to produce the best available evidence that we have on effective solutions, this should put us all like this sends really like rings all the alarm bells. We should
yeah,
be doing many of these studies. But I would point to funding.
mm,
It has been very little. It is dripping. It is not anywhere near the funding that we see for population health studies. So, for example, when you look at the effects of extreme heat or climate change, most of the funding from the NIEHS, which is the health sciences, actually goes to vulnerable communities among the general public. Once you start to highlight that your study now is going to focus on workers, you're kicked out of NIHS, you go to NIOSH. And the
mm,
budget of NIOSH, the budget of OSHA, is really small compared to the budgets of EPA, for example, or
mm,
NIH or NSF. These really massive, big budgets that would fund many, many. So that you get a lot of competing grants for very small, tiny proportion. And then state departments like you in Washington State, which you've done great work in having an outdoor regulation. State leadership comes from Washington, California, Colorado, and other states that are just Maryland right now. Also, they got their state rule when the federal standards is actually stumbling. And it is stumbling right now with the proposed rulemaking that OSHA did. And I've talked about this and probably talked with Tom about this as well, that the OSHA standards, proposed standards came out and it was going in full momentum. And now we don't know what's going to happen with these standards. There was just hearings, and I don't think there is enough support. And the final point is why we see less about this is industry partnership. You cannot make these studies without having an industry that believes in this and says, sure, let's do it. So you think about all the leverage points that we have right now for construction. I mean, we try to talk to many construction sites here in the US. Nobody is interested. And so we're moving one level up to talk to insurance because that's the real boss of construction. So should we be able and successful in having an insurance product in which these companies can purchase or can have and cover some of these injuries, that could pump a lot of money into getting this. But it's not rocket science. I'm telling you, even the small incremental changes, like the one in Washington, like the one in California, the California standard has been there since 2005. The sky did not fall. And, you know, I, I'm not going to digress. I'll stop here. So you take more questions.
Thank you.
Thanks, Juan.
Thank you, Juan. Anybody else got a question?
Yeah, this is Tom Gassert. And just for disclosure, I'm also with the Harvard School of Public Health and Department of Environmental Health. And I've seen Barrak speak before. His work is really eloquent and quite good. So thank you, Barrak.
Thanks, Tom.
And just to touch on a couple of things, for example, Joan, you mentioned about worker comp. Could there be some incentives there, what they pay for? It's always a battle, and if you don't have regulation behind behind it, it's very difficult. And the second most important thing for us as physicians, many of us are, or we work with physicians, when you make a diagnosis of a work-related injury or illness or even death, you have to give a diagnostic code. You know, the ICD-10 we're using now, ICD-11 is now posted globally, and there are very specific heat-related illnesses. You know, beginning with the most severe heat stroke, but there are also other types of accidents and injuries that have individual codes. But if you have somebody who has a heart incident or a mental, you know, status change, something like that, if the diagnostic code does not include a heat-related or work-related condition, even if it's secondary in terms of causation, then it's very difficult to get employers to change without regulation. And Cal OSHA, as you mentioned, Barrak, is probably the standard that was most taken up by the OSHA federal standard that's now kind of wallowing in policy land, although it is on the books on CFR. So we can still follow those standards and those outlines. Washington State, for a friend there, Juan, you know, you also have a heat standard, occupational heat standard, and there are several states that are generating them now. And the problem with OSHA and NIOSH is that this current government wants to push everything over to the states. So if you have a state program, you can certainly exercise that and lobby on that. And we have to educate our healthcare workers who are doing the diagnostics. But the key thing about the the work in Latin America, it's such beautiful work with the Adelante initiative, well recognized now as a global standard. That you know these steps, these very, very basic, simple steps, can be used very cheaply, including rescue steps, emergency response, first aid responders, training of coworkers, setting up a joint health and safety committee that has a heat health program as outlined by OSHA. All these things can be done. And of course, we've got the global scene, but that's enough from me. Thank you.
Thanks, Tom. And yes, I just want to add that state leadership is essential and key right now.
Mhm.
And I think this is whatever that is now halting the federal action, the playbook is out there.
Yes.
The full 700 pages of the OSHA standards, which I blocked a month of my life to read, is out there. It is very useful. And also, Washington State are thinking of an indoor heat standard as well. So it's not just the outdoor. And there are many others. New Mexico now is thinking about this, and Arizona. Hopefully, I hope they follow suit. And New Jersey, New York, New Hampshire, maybe we should. Don't no place is cold for the effects of extreme weather and extreme heat. And you could have your metabolic rate be too high that would increase your core body temperature, even if the weather out is 65 or 70.
Yeah, it's so true. Thank you so much for this presentation. It's wonderful. We will be sharing it online and along with a link to your presentation so that people can look at those incredible graphics. So thank you very much. And thank you everybody for attending. I appreciate it. Oh, Paul, you had
One
something?
last point. I know we've run out of time, but just to throw out there, maybe to kick some of these standards into gear, we should publicize these injuries to our colleagues, the injury compensation lawyers. And if they know about these connections and start to look for clients, they will find clients. And that, the legal establishment may come in handy with this sort of thing. So just keep that in mind.
They often do.
So true. Thank you. Have a
Okay.
nice evening, everybody.
Thanks,
Thank you
everyone.
very much.